Question 1. A nurse receives reports on 4 clients. Which client should the nurse assess first? A. A client with a blood pressure of 90/60th millimeter of mercury and dizziness reported during ambulation. B. A client requesting assistance with toileting. C. A client who is preparing for discharge today. D. A client reporting mild nausea after eating. Answer. A. A client with a blood pressure of 90/60th millimeter of mercury and dizziness reported during ambulation. Question 2. Which task is most appropriate for the nurse to delegate to the unlicensed assistive personnel, UAP? A. Administering oral medications. B. Ambulating a stable post-operative patient. C. Assessing a new surgical wound. D. Developing a care plan for a newly admitted patient. Answer. B. Ambulating a stable post-operative patient. Question 3. A nurse is caring for a client who is confused and frequently trying to get out of bed. What is the priority action? A. Place the bed in the lowest position and ensure the call light is within reach. B. Apply wrist restraints immediately. C. Request a room change closer to the nurse's station. D. Provide a sedative as prescribed. Answer. A. Place the bed in the lowest position and ensure the call light is within reach. Question 4. Which client should the nurse assess first after receiving a shift report? A. A client with a blood glucose level of 130 milligrams per deciliter. B. A client reporting chest pain and shortness of breath. C. A client with N4 antibiotic scheduled in 1 hour. D. A client requesting a PRN pain medication. Answer. B. A client reporting chest pain and shortness of breath. Question 5. Which task should a nurse assign to a licensed practical nurse, LPN? A. Administering intravenous push medications. B. Performing an initial assessment on a newly admitted client. C. Reinforcing teaching about post-operative wound care. D. Developing a discharge plan for a client. Answer. C. Reinforcing teaching about post-operative wound care. Question 6. The nurse is making room assignments on a medical surgical unit. Which 2 clients are appropriate to share a room? A. A client with a draining infected wound and a client post-appendectomy. B. A client with tuberculosis and a client with heart failure. C. A client with a hip replacement and a client recovering from pneumonia. D. A client with neutropenia and a client with cellulitis. Answer. C. A client with a hip replacement and a client recovering from pneumonia. Question 7. A nurse must delegate tasks during an emergency situation. Which task is appropriate to delegate to the UAP? A. Assisting with CPR. B. Applying oxygen via nasal cannula. C. Establishing for access. D. Administering emergency medications. Answer. A. Assisting with CPR. Question 8. A nurse is planning care for 4 clients. Which client should be assigned to the LPN? A. A client receiving continuous intravenous heparin infusion. B. A client with a new diagnosis of type 1 diabetes requiring extensive teaching. C. A client requiring sterile dressing change on a surgical wound. D. A client experiencing acute chest pain. Answer. C. A client requiring sterile dressing change on a surgical wound. Question 9. A post-operative client is reporting increasing pain and swelling in the leg. What is the nurse's priority action? A. Elevate the leg on pillows. B. Apply a warm compress to the leg. C. Notify the healthcare provider immediately. D. Encourage the client to ambulate more frequently. Answer. C. Notify the healthcare provider immediately. Question 10. A client is scheduled for discharge but has questions about new medications. What should the nurse do first? A. Provide written instructions and ask the client to read them at home. B. Delegate the teaching to the LPN. C. Postpone the discharge until the client's questions are addressed. D. Tell the client to ask the pharmacist for clarification. Answer. C. Postpone the discharge until the client's questions are addressed. Question 11. A nurse is supervising a new graduate nurse. Which action requires immediate intervention? A. The new nurse places soiled linens on the floor temporarily. B. The new nurse documents a medication administration late. C. The new nurse administers medication without checking two identifiers. D. The new nurse asks for assistance when transferring a heavy patient. Answer. C. The new nurse administers medication without checking two identifiers. Question 12. Which client should the nurse assess first during morning rounds? A. A client requesting a PRN sleep aid. B. A client with new onset of slurred speech. C. A client who needs assistance with morning hygiene. D. A client asking for ice chips. Answer. B. A client with new onset of slurred speech. Question 13. A nurse is preparing to delegate a task. Which factor is most important to consider? A. The preference of the UAP. B. The skill level required for the task. C. The time required to complete the task. D. The complexity of the documentation. Answer. B. The skill level required for the task. Question 14. A nurse must prioritize care for 4 clients. Who should be seen first? A. A client with a potassium level of 3.4 milliequivalent/L. B. A client with an oxygen saturation of 88%. C. A client scheduled for a dressing change. D. A client complaining of constipation. Answer. B. A client with an oxygen saturation of 88%. Question 15. A client has a prescription for warfarin. Which finding requires immediate action by the nurse? A. Reports of easy bruising. B. Reports of mild nausea. C. Reports of frequent urination. D. Reports of occasional dizziness. Answer. A. Reports of easy bruising. Question 16. Which task is appropriate for the RN to delegate to the UAP? A. Assisting a client with range of motion exercises. B. Inserting a Foley catheter. C. Performing a sterile dressing change. D. Initiating patient teaching about a new medication. Answer. A. Assisting a client with range of motion exercises. Question 17. A nurse is assigning tasks to the healthcare team. Which task should be assigned to an LPN? A. Developing an individualized care plan. B. Performing an initial assessment. C. Monitoring a client receiving blood transfusion. D. Interpreting laboratory results. Answer. C. Monitoring a client receiving blood transfusion. Question 18. A client receiving a blood transfusion reports chills and back pain. What is the nurse's priority action? A. Increase the infusion rate. B. Stop the transfusion immediately. C. Administer acetaminophen. D. Notify the healthcare provider after the transfusion is complete. Answer. B. Stop the transfusion immediately. Question 19. A nurse is caring for 4 clients. Which client should the nurse evaluate first? A. A client with a blood pressure of 140/90 mmHg. B. A client with a respiratory rate of 8 breaths per minute. C. A client requesting to speak with the chaplain. D. A client with a heart rate of 90 BPM. Answer. B. A client with a respiratory rate of 8 breaths per minute. Question 20. Which action indicates that the nurse understands appropriate delegation principles? A. Assigning a UAP to obtain vital signs on a stable patient. B. Asking a UAP to insert an NG tube. C. Directing an LPN to perform a comprehensive initial assessment. D. Delegating a UAP to teach a client about diabetes management. Answer: A. Assigning a UAP to obtain vital signs on a stable patient. Question 21. A nurse is reviewing assignments for the shift. Which task is appropriate to delegate to the UAP? A. Feeding a client with recent stroke and impaired swallowing. B. Assisting a stable client with ambulation. C. Monitoring a client's blood glucose level. D. Assessing a client's pain level. Answer: B. Assisting a stable client with ambulation. Question 22. A client develops sudden dyspnea and anxiety. What is the nurse's priority action? A. Obtain an oxygen saturation reading. B. Administer a sedative. C. Encourage slow, deep breathing. D. Notify the healthcare provider after documentation. Answer: A. Obtain an oxygen saturation reading. Question 23. A client is at risk for falls. Which intervention is most important for the nurse to implement? A. Place a fall risk sign at the door. B. Keep personal items within the client's reach. C. Instruct the client to call for assistance before ambulating. D. Place a chair alarm to alert staff if the client tries to stand. Answer: D. Place a chair alarm to alert staff if the client tries to stand. Question 24. A client on a medical surgical floor is developing signs of sepsis. What is the nurse's priority action? A. Administer antipyretic as prescribed. B. Increase the 4 fluid rate. C. Obtain blood cultures before starting antibiotics. D. Apply a cooling blanket. Answer: C. Obtain blood cultures before starting antibiotics. Question 25. The nurse is caring for a client with hypoglycemia. What is the immediate nursing action? A. Administer glucagon IM. B. Provide 4 ounces of orange juice. C. Notify the healthcare provider. D. Document the blood glucose level. Answer: B. Provide 4 ounces of orange juice. Question 26. A nurse observes a UAP repositioning a client incorrectly. What should the nurse do first? A. Stop the UAP and demonstrate the correct technique. B. Report the UAP to the charge nurse. C. Reassign the client to another staff member. D. Document the incident in the client's record. Answer: A. Stop the UAP and demonstrate the correct technique. Question 27. A client is receiving 4 potassium chloride. Which finding requires the nurse's immediate attention? A. Reports of nausea. B. ECG shows peak T waves. C. Urine output of 60 milliliters per hour. D. Mild burning at the 4 site. Answer: B. ECG shows peak T waves. Question 28. The nurse is prioritizing care for 4 post-operative clients. Which client should be assessed first? A. A client complaining of incisional pain rated 8 out of 10. B. A client with no bowel movement for 2 days. C. A client with a respiratory rate of 28 breaths per minute. D. A client requesting assistance with toileting. Answer: C. A client with a respiratory rate of 28 breaths per minute. Question 29. Which action demonstrates appropriate delegation by the nurse? A. Delegating medication administration to an UAP. B. Asking an LPN to monitor a stable post-operative client. C. Assigning an LPN to perform initial admission assessment. D. Instructing a UAP to teach coughing and deep breathing exercises. Answer: B. Asking an LPN to monitor a stable post-operative client. Question 30. The nurse is assigning a client newly diagnosed with diabetes to an LPN. Which task is appropriate for the LPN? A. Providing initial dietary education. B. Assessing the client's readiness to learn. C. Monitoring blood glucose levels. D. Evaluating the effectiveness of teaching. Answer: C. Monitoring blood glucose levels. Question 31. A nurse is preparing to administer a high-alert medication. What is the priority safety measure? A. Ask another nurse to witness the medication administration. B. Verify the client's room number. C. Ask the client to state their full name. D. Document the administration before giving the medication. Answer: A. Ask another nurse to witness the medication administration. Question 32. A client reports new shortness of breath and a productive cough. What is the nurse's priority action? A. Place the client on oxygen. B. Obtain a sputum culture. C. Notify the healthcare provider. D. Elevate the head of the bed. Answer: D. Elevate the head of the bed. Question 33. Which client should the nurse see first after receiving the following shift report? A. A client with a potassium level of 5.5 milliequivalent/L. B. A client reporting increasing lower extremity edema. C. A client with audible wheezing and labored breathing. D. A client requesting help ambulating to the bathroom. Answer: C. A client with audible wheezing and labored breathing. Question 34. The nurse is delegating hygiene care to the UAP. Which instruction is most important to include? A. Notify the nurse if the client's skin is dry. B. Notify the nurse of any skin breakdown or redness. C. Encourage the client to participate in care. D. Allow the client to rest between activities. Answer: B. Notify the nurse of any skin breakdown or redness. Question 35. Which action should the nurse take to ensure client safety when using physical restraints? A. Remove restraints every 2 hours to assess circulation. B. Double knot the restraints for security. C. Apply restraints without notifying the healthcare provider. D. Position the client supine at all times. Answer: A. Remove restraints every 2 hours to assess circulation. Question 36. The nurse is teaching an LPN about postoperative care. Which action requires intervention by the RN? A. The LPN monitors urine output. B. The LPN reinforces wound care teaching. C. The LPN documents breath sounds. D. The LPN interprets ABG results. Answer: D. The LPN interprets ABG results. Question 37. The nurse is caring for a client with a feeding tube. Which action requires intervention? A. Checking tube placement before feeding. B. Elevating the head of the bed 30 to 45 degrees. C. Administering feeding without confirming tube placement. D. Flushing the tube with water after feeding. Answer: C. Administering feeding without confirming tube placement. Question 38. The nurse is planning care for a client at risk for aspiration. Which intervention is most appropriate? A. Place the client in a supine position for feeding. B. Use a straw for all fluids. C. Offer small amounts of food and liquids. D. Encourage rapid consumption of food. Answer: C. Offer small amounts of food and liquids. Question 39. The RN is preparing to delegate tasks. Which principle should guide the delegation process? A. Assign only tasks that require minimal supervision. B. Delegate according to the individual's scope of practice. C. Allow team members to choose their tasks. D. Delegate based on convenience. Answer: B. Delegate according to the individual's scope of practice. Question 40. A client's family asks to review the client's medical record. What should the nurse do first? A. Allow the family to view the chart immediately. B. Refer the family to the nurse manager or privacy officer. C. Make copies of a chart for the family. D. Review the chart with the family. Answer: B. Refer the family to the nurse manager or privacy officer. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!